Public health messages and practice have historically emphasised the eat less, move more mentality in efforts to motivate people to reach a weight that is considered healthy according to traditional measurements such as body mass index. However, this dominant, what I would call individualist approach, tends to use messages rooted in fear, shame, and blame, and is extremely oversimplistic, implying personal responsibility for higher weight, when in fact the vast majority of determinants that lead to someone being of a higher weight are really out with their control. So, this misconception and poor understanding of factors that influence weight reinforces these negative stereotypes of people with higher weight, portraying them as lazy and lacking willpower, for example, and this manifests as weight stigma. So we know from pieces of work such as the Foresight Report that the factors which influence weight are extremely complex. There are over 100 of biological, psychological, social, political, commercial, and economic factors at play, and many of these are interrelated. And the root causes of higher weight and poor health and well-being for many lie in poverty and inequity. So obesity rates are consistently higher in communities associated with lower incomes. And in Scotland, children living in communities associated with lower incomes are more than twice as likely to be at risk of obesity than children living in more affluent areas. We also know that it's 3 times more expensive to consume a healthy diet, and fast food outlets in Scotland are significantly more prevalent in low income areas, and access to healthy food is more limited. Also, poor educational achievement is also associated with lower capacity to obtain, process, and understand health information. And we know that stress and trauma, which again is experienced unequally across the socioeconomic gradient, is clearly associated with our physical and mental health. For example, those that have suffered adverse childhood experiences are between 13% and 50% more likely to be in a higher weight category. Undertaking physical activity can be much more challenging in places associated with lower incomes due to things like safety issues, less welcoming spaces to play and exercise, and limited access to quality green space. We also know that children living in communities associated with lower incomes are more likely to see marketing and advertising of unhealthy foods when compared to their counterparts living in more affluent areas. And then intersecting factors such as socioeconomic status, ethnicity, language barriers, gender, immigration status, and also our past experiences of bias and weight stigma may also prevent people with higher weight from accessing the healthcare services that they need. Improving understanding of the complexities and the multiple drivers of obesity need to be actively promoted, including those wider societal actions such as reducing poverty, creating healthier places and spaces, improving education, and ensuring more equitable access to healthcare will make the most impact. And this improved understanding will also help to reduce stigma and the damaging consequences that so many people currently living with higher weight experience.